contracting COVID-19 has led to mental health disorders like anxiety, stress, depression, and other psychological issues. Saba, the pandemic has forced us, out in the open. It's been really tough on each one of us. Issues related to mental health have come out even more now. Even if, people aren't suffering mental health problems, they're certainly somewhere they're fatigued, right? Because of isolation, the worry, the uncertainty. So how have you coped with this in the last 2 years?
Ambika, I feel like isolation is a very charming thing for the privileged, but not a very happy experience for those who aren't privileged. And I think that for me, the last 2 years have been tough, but very liberating at the same time. I think being a business owner, we're a small business. We had not just my own personal problems to deal with in this time, but also the problems of all the employees that kind of are attached to you. Yeah. And I think while you want to make sure that you're taking care of your own well-being, I think it's also important to keep in mind that your employees go with you, and it's important to think of their mental health, their state of mind at the time. And we were working through the pandemic, but I think for me it was a period of I internalized everything in a way. And for me it was a period where I discovered so many things about myself as an entrepreneur, as a woman, as a daughter, and also as to how I want to lead my life. But I think I come back to the same point that I had the privilege of being liberated through my isolation, but a lot of people I know didn't feel that way.
I have a question for Captain Usha. Ma'am, the emotional well-being of nurses was challenged like never before by COVID, and I can speak from a certain amount of experience because when I was in hospital, this was one aspect that I noticed was very severe.
So I think the whole healthcare workers have been put to immense stress and trauma in this period. And fortunately, the profession has taught us resilience. It has taught us duty, devotion, and care to the people who need our service. But then there is always this fear of the unknown and impending fear. Do not know what's going to happen next. Young people leaving back their families at home, coming to work. I think it calls for a different DNA to handle the mammoth task that we have all undergone in this past year. As such, representing the nurses of this country, I must tell you that nursing is a very hard profession. And young people coming to work without knowing what's in store for them, without fear. I think we salute the entire workers of this country today for having stepped in and taken charge with courage, conviction, and care and competence, and putting the country back on the map today to say that with great pride that we have handled the situation, we have learned lessons, we will work harder if there is an impending situation like this, and I'm sure we will come out of it strong.
I have a question for Mr. Jiten Shanti. Jitenji, I know that you have been responsible for a very sensitive job. Your organization has cremated more than 4,000 people, all of them strangers, and some of them, just not being able to be identified. You slept in an ambulance for days outside your home, Jitenji. Your family tested positive twice. You lost an ambulance driver to COVID, but you kept going on. How difficult was that period for you, both mentally and emotionally?
अभी तक हम उस डिप्रेशन से निकले नहीं हैं। मैं, मेरे बच्चे, मेरी मिसेज, मेरे ड्राइवर, मेरे वॉरियर्स जिन्होंने इतना काम किया है इस कोरोना के अंदर, आज भी बिना किसी सरकारी मदद के, हम 25 साल से ऑलरेडी कर रहे हैं, लेकिन आज जो काम करने के बाद हमें सुकून मिला कि हमने कुछ देश के लिए किया है। लेकिन वो जो शॉट्स है, वो जो सीन है, वो परिवारों का जाना, एक एक परिवार से 4 5 लोगों का डेड बॉडीज का आना, मैं भूल नहीं पा रहा।
Ranjan sir, my next question is to you. Does someone like you and your volunteers, at what point does it not become a personal about you anymore and it's just about the people that you're helping? What is that one thing that it takes for you to make that shift?
Yeah. I mean, I remember the breaking point in my case came when I got a call that we have lost a family member. I had lost a family member to COVID. And at that very moment, I got a call from one of the patient's family members who was hospital hopping to find a bed the entire day, again screaming at me saying कि मैं अपने mother को hospital के बाहर लेके खड़ा हूँ, I will lose her if you don't help me. And he lost her eventually. And at that point in time, it became so difficult for me to continue. Even now I have those voices playing in my mind. And I was at it 24/7. Family had taken a backseat. Our own mental and physical health was the priority. My team would talk about taking frequent breaks. There was no time. You take a break, then get a call from someone like 2-3 a.m. in the morning and be back at it. All we cared about was, can I save one more family? And, there was no time to rest.
Dr. Anjali, mental health issues have long been equated in India with psychotic disorders like symptoms like disruptive behavior, hallucinations. But lately, and in part thanks to COVID, an increased awareness of mental health issues has shifted the focus to common but less obvious mental health symptoms.
I'm very happy that we have finally started discussing psychiatric disorders, and we are no longer looking at people who visit psychiatrists as mad people. Now, what we need to do is we need to give emotional health as much importance as we have been giving physical health in the last 1.5 years. Because you will agree with me that there is no health without mental health.
I'd like to ask you this next question. It's been a very long journey from your TikTok campaign to your Dettol campaigns. And what were the learnings that you got from that? And how did this come about?
I think the stories were a way to express gratitude, but were also a way to create a sense of communal hope. कि अगर हम साथ में मिलके किसी भी चुनौती का सामना करें तो हम उस चुनौती को सामने जीत सकते हैं. And that, I think, sense of hope is what we were able to create. And I think you spoke about it also. And I think that's something that I think is a responsibility that we as brands have, and we take it very seriously.
Yeah, I'd like to ask a question to Trisha Shetty, ma'am. You launched She Says in the year 2015, and we believe it's a platform that aims to educate, rehabilitate, empower women to take direct action against sexual assault in India. In the last 5 years, have we been able to see any changes?
I'm really glad now governments, institutions, press, media is talking about this in a way where our older generation never got to speak about these things. So I'm grateful for you, Amitabh, for NDTV to have these conversations on mainstream channels, because only through more conversations will we change these cycles of oppression and abuse that we've been carrying on for generations.
और इस वक्त हमारे साथ हैं दिल्ली के उप मुख्यमंत्री मनीष सिसोदिया.
Thank you for joining us. And congratulations on the amount of vaccinations you've done. How confident are you there will not be another wave? And in case there is, are you more prepared for it this time?
अब हमारी तैयारी जो है, एक्सपर्ट्स जो सलाह दे रहे हैं कि 40-45 हज़ार 50 हज़ार तक की तैयारी हमें करके रखनी चाहिए, तो हम उस तरफ काम कर रहे हैं कि अगर हालांकि इतना वैक्सीनेशन इतने बड़े पैमाने पे हो रहा है तो ईश्वर करे कि वैसा दिन ना देखना पड़े, पर फिर भी अगर ऐसा कुछ होता है तो कम से कम 40-50 हज़ार केसेस पर डे भी अगर आते हैं तो उस वक्त की हम तैयारी करके चल रहे हैं, इंक्लूडिंग गवर्नमेंट एंड प्राइवेट सेक्टर में. ये हमारी तैयारी है.
So, Lakshman, the world has been talking about a code red situation, with climate, and we've seen Reckitt investing significantly in a positive consumer action that will have an impact in daily lives. How do these small behavior changes create that kind of an impact that we are working towards?
As a company, we're clearly making a lot of investments, and we have a big commitment that says we want to get to where the Paris Accord says we need to be by 2050, but we want to get there 10 years earlier. So in India, for example, we have a bunch of things going on with, we're basically buying renewable power for all our India operations. We've reduced carbon by, over 50% in the last 9 years. Water consumption is down, 40% down in the last 8 years or so. But the real question is that enough? And what we are really focused on are these small changes, this kind of butterfly effect, where the wings of the butterfly, make big changes further out.
Yeah.
And so we have to think about that, particularly with consumers, about water usage. How do you ensure that what you wash, when you wash your vessels at home, that you're not wasting water? When you're brushing your teeth, you're not wasting water. These are the small actions. And when you think about the fact that we have 1.3, 1.4 billion people here, these small actions make a massive difference. It's that butterfly effect.
Wonderful similes that you've been bringing to the entire program. First about the trapeze artist and the net that, all of them are falling down into and saving it. And now the butterfly. And the important thing is that the color changes as you go further down.
Right.
It's so beautifully put, Mr. Lakshmi, really.
And that, you remember it as a result, yeah. Aditya Thackeray, thank you very much for coming here. It's great to have you again. You always been here. And I'm not just saying this, there has been a major change with this government. You were hit badly by COVID, but from all reports, it was handled brilliantly. Many of your officers did very well, and it was just a very tough situation. It was handled well. And now, the other big change is that this government is actually very serious about the environment. And there is a connection between environment, our health, sanitation, our health and environment. How do you see this entire connection? And of course, there will be trade-offs and balance, between economic activity and environment. But in a way, if you want to be sustainable, both have to work together, right?
Thank you, sir. It's always a pleasure being on an NDTV panel because there's always work happening here and there's always action on ground. We have been, terribly hit by COVID, and I guess it's the world over. In that case, we just had to be accountable and transparent with the people, tell the people, let them know what is happening, how we should be responding to it, remain calm and respond to it. We expect a lot of industries, manufacturing industries, factories to come into Maharashtra. What we need to do is just add the word sustainable to it and carry on with that. Because with development, you will have a lot of things that come in along with it. For example, our energy consumption is going to increase. For countries like India, for states like Maharashtra and other neighboring states, we will keep industrializing. But when we look at, things like the Paris conference or the COP26, we need to look at what we can take from it. And if our energy consumption is going to go higher, we need to look at a greener energy consumption. For example, we just brought in the EV policy right now. And as a matter of that, we've got a lot of, demand for electric mobility in our state. But when we look at electric mobility, only electric vehicles are not enough. We need to build an ecosystem which is clean and green. So are those vehicles being powered by renewable energy? So things like the Mumbai-Nagpur highway, we're solarizing that highway, generating 250 megawatts in the next 1.5 years from that highway. Things like that, floating solar. We're looking at an ecosystem that is green.
Tapsi, I believe you have a question for Prasoon.
Hi Prasoon sir, good evening. We've been hearing the anthem the whole day, and we will through the campaign this year. So I want to ask you, what was the inspiration this time around?
This year is about no one being left behind. Now, where did this need for no one being left behind, no one should be left behind comes from? You remember our society used to have a word called unfortunate. When we saw someone suffering, we said the person is unfortunate. Now we don't know where unfortunate got replaced with the word loser. You started saying that the person is a loser. Because we became a society which is collective, from collective to individualistic. And इसीलिए कहीं ना कहीं ज़रूरत पड़ी कि हम औरों के बारे में सोचें. वरना एक कलेक्टिव सोसाइटी कलेक्टिवली फंक्शन करती है, उसे रिमाइंड नहीं करना पड़ता है कि आप दूसरों के बारे में सोचें. और मैं इस पे सोच रहा था तो मुझे लगा कि ये जो पता नहीं कब हमने सीख लिया कि पीछे मुड़कर नहीं देखना है. पता नहीं कब हमने सीख लिया अमित जी कि पता नहीं कब हमने सीख लिया कि पीछे मुड़कर नहीं देखना है. जो छूट रहा है छूटने दो, जो टूट रहा है टूटने दो. पर आज कुछ और सीखना है. सीखना है पीछे मुड़कर देखना. अतीत से लिपटने के लिए नहीं, अतीत से लिपटने के लिए नहीं, वर्तमान से न्याय करने के लिए पीछे मुड़कर देखना है, इसलिए कि कोई पीछे न रह जाए. सो आई थिंक समवेयर दिस पैंडेमिक हैज मेड अस रियलाइज कि किसी और का कोई दुश्मन नहीं है, ये हम सबका, कहता है ना दुश्मन, when the enemy comes we sort of unite. Somehow this collective enemy of the humankind or of the earth, of the planet, has subconsciously united us.
I just wanted to ask you, Taapsee, once again about these girls you've adopted and what's that educating girls are so important to you, and why is that?
I think because we have to start from the start. Because it's extremely important to educate them first, so they should know their rights, what they should expect, what they can expect from everyone around, from us, from their government, from what is their real strength, to explore their full potential. The fact that they are not educated also ends up bringing down their confidence level in the society. So that, for me, I identified that as the root cause from where it begins. So I wanted to instill that confidence in them, where they know they have the controls of their life in their own hand. They know the right from the wrong. They know which decision to make, which is the right decision to make at what time. So it's very important to impart education so they get that confidence. That's why I started from the ground level.
And they know their rights. I think that's the point you mentioned.
They know their rights, they know their duties, they know their expectations.
एक्चुअली आपका ये जो डेटॉल का बनेगा स्वस्थ इंडिया जो मिशन है, इसके पीछे एक विजन है, तो अगर आप दर्शकों को ये बताना चाहें कि वो क्या विजन है.
संकेत, कुछ भी ऐसी कोई मुहिम टू स्टार्ट ऑफ एंड टू डू इट फॉर 8 years, आई थिंक 3-4 चीज़ें ज़रूरी है. एक है वैल्यू सिस्टम. आई थिंक उसके बिना ऐसी चीज़ स्टार्ट नहीं हो सकती है. एंड आई थिंक हमारी कंपनी का पर्पस which Lakshman had crafted when he came to protect, heal and nurture in the relentless pursuit of a healthier, cleaner world. And the key word is relentless. That is a value system that guides us. Your fight of making hygiene, highest quality hygiene, wellness and nourishment a right and not a privilege is something that guides us. Our compass, which we call a compass, it's a value system, it's put in a circle, and at the middle of the circle is do the right thing always. So all of these guide each and every employee of ours to participate in this and to push this and to play their role in this.
Absolutely.
Thank you. I want to introduce Mr. Abhijit Banerjee, Nobel laureate in economics. Thank you very much. You know, the health of our children, the health of our society and its impact on the economy. Not just looking at pure economy, the point that we were making right now, but the sources of better economic growth. How important is health, and has India paid enough attention to it?
I think India has not paid enough attention to it. This has been said many times, but I think we're sort of jugaad the healthcare system. Healthcare system is kind of the classic jugaad in the sense that we know we don't have enough doctors in rural areas, and we've relied throughout on people who call themselves doctors, who are what unfortunately are often called Bengali doctors, which means they are not actually qualified. That's a Bengali doctor in Rajasthan. It's people with no degrees whatsoever. And I think that's in the end, that might be a good thing, to have a clear recognition that we need to do more to actually somehow deal with the reality on the ground.
Okay, do stay on. और अब वक्त आ गया है रात को थोड़ी सी रफ्तार देने का. इस वजह से रफ्तार को मंच पर आमंत्रित करना चाहता हूँ.
रफ्तार वो बोले मुझे थोड़ा आगे चल, मैं आगे चलता चला गया. वो बोले मुझे थोड़ा आगे बढ़, मैं आगे बढ़ता चला गया. ये check. कहते हैं मुझे रैप करो स्लो, ये लो अगली बार धीरे, मैं नहीं गाने वाला। स्वरू मन की लो फोटो मेरे तन की, मुझसे ज्यादा सन की नहीं है तेरा स्टार। वो स्काई हाई मैं अंतरिक्ष पार, सियाही दे गवाही कलमकार रफ्तार। वो बोले मुझे थोड़ा आगे चल, मैं आगे चलता चला गया। वो बोले मुझे थोड़ा आगे बढ़, मैं आगे बढ़ता चला गया। वो बोले मुझे थोड़ा आगे चल, मैं आगे चलता चला गया। वो बोले मुझे थोड़ा आगे बढ़, मैं आगे बढ़ता चला गया।
स्वस्थ भारत जब रहेगा तभी तो भारत संपन्न बनेगा।